we're going to blow this case and the lid wide open on POTS today. So here we go, everybody. I asked the group this week, which is, would you rather hear about a set topic, or do you really want to hear about what Bethenny Frankel is talking about, which is her struggle with POTS, and many people struggle with POTS.
And that's the thing, Bethenny Frankel, she's a well-known reality star. I have to say I'm a big fan of hers. I watch reality TV and I love her and she's hilarious. But here she is. She has all of the resources that anyone could imagine. And yet she is still dealing with a big struggle with her POTS.
Yeah, and there's over 1 million people that are has the diagnosis of POTS. This is in the US alone. And to me, that's a gross underestimation. And so I would say there are millions of people that are struggling with POTS. And the truth of the matter is, it doesn't matter if someone has as much resources as Bethenny does. And I've seen people who've been to Johns Hopkins, Mayo Clinic, and then they come to us, or somebody who doesn't have any resources and are seeing their conventional doctors. The truth is, almost everybody I've ever met everybody I've met is in the same boat, which is that they have lots of symptoms, they don't have answers, and they are getting worse. And that's the opposite of, that's the opposite of the experience we have with the people we work with in our programs.
When the people come in and they talk to you, they say, "Oh, but I don't know if you can help me, Dr. Maggie. I have POTS."
Yeah.
I hear what you say to them. You say, "This is easy. I can handle this so easy." It's one of the easiest things for you to turn around. And yet in the conventional medicine world, and even in most of the functional medicine world,
Mhm.
people are not able to do that and they're struggling.
Now, here's the thing. If you're struggling with those symptoms, or you know somebody who is, tag their name in the comment section below, because one of the things I want to do is raise the level of awareness that there are answers and solutions for POTS and dysautonomia that none of your doctors know. So if you can help me out with that, put their name in the comment section.
Would you like to hear what Bethenny Frankel has to say about her struggle now, Dr. Maggie?
Let's do it.
We're asking why my face looks different in my makeup videos, and it's because I am messed up. I am not doing that great. I'm so dehydrated and riddled with aches and pain. I've gained like 4 pounds while being here because my body's trying to hold on to any water it can. I wake up like every 2 hours in such pain and dying of thirst. My doctor said it's definitely connected to this POTS syndrome that I have.
Okay, so she talks about some interesting symptoms there: weight gain, extreme thirst, a lot of pain, waking up at night.
Yeah.
Are these classic things that you hear about with POTS?
No, and that's the interesting thing is, if you go and Mr. Google and you actually search on POTS, the classic symptoms when you look at POTS really fall in the realm of more cardiac. This is why this diagnosis often falls to the cardiologist, and I'm going to tell you it doesn't belong there. Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power-packed 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. The classic symptoms when you look at POTS really fall in the realm of more cardiac. This is why this diagnosis often falls to the cardiologist, and I'm going to tell you it doesn't belong there. But the classic symptoms that you're talking about is fast heart rate. Now, when you have tachycardia, super fast heart rate, your heart becomes less efficient, and therefore it can cause big fluctuations in blood pressure. So you can have blood pressure drops, ups and downs, ups and downs. What does that trigger? It can cause you to have dizziness, really lightheaded. It can cause you to be nauseated. It can cause you to have severe anxiety. It can cause you to be unable to walk or exercise. So a freaking big deal. So these symptoms, when you think about it and you hear postural orthostatic, meaning blood pressure, and tachycardia, people think this is a cardiology problem. And I guarantee you she's seeing a cardiologist. How do I know? Everybody's going to Johns Hopkins, Mayo Clinic, her specialists, all that. And many of them are cardiologists dealing with this syndrome, but yet people are getting worse.
Okay, so if it's not a cardiologist who you should see, the next person that they might want to go see then is a rheumatologist. Could you get help there?
Because she just mentioned, now I think she's got, I don't know if it was in this clip, but I saw in another clip where she mentioned that it's mixed up with this autoimmune thing, she said. And so I think she's smart enough herself, and her doctors are smart enough, somebody's smart enough to link having these symptoms with autoimmunity. Because I frequently see, and look, whether you have an autoimmune diagnosis or not, if you have these symptoms relating with POTS, there's a high likelihood there's an autoimmune component underneath it. And yet, when you say, okay, maybe now it's an autoimmune issue, not a cardiac issue, who do you go see? The rheumatologist or your gastroenterologist. What do they know jack about tachycardia, blood pressure changes, lightheadedness, thirst, or whatever? Nothing.
Not
So
going.
then that's the problem. These people are going to a cardiologist. How many of you guys tell me if you have these symptoms or you know someone have gone to the cardiologist, have gotten no help or have gotten worse, have gone to a rheumatologist, have gotten no help or have gotten worse. And then now you're wondering, who the heck do I see? And this is for those of you who have classic symptoms. When I actually look at Bethenny's case, and how many of you guys with POTS listen in chat right now don't have, they may have some of these classic symptoms, but then listen, she has extreme thirst. It's not just thirst. She has a lot of pain. She has a lot of swelling. She has insomnia and she has extreme anxiety. So there's a lot of different symptoms that are coming along with the POTS that quote unquote don't fit the definition. Someone like her, has she been not had these resources, may not even get the diagnosis, right? So can some people with POTS have thirst? Absolutely. I would love to see, because people are talking about it all, like in chat listing these symptoms, right?
Yeah,
All
and
the medications for POTS didn't work.
the alumni who are commenting are so smart and are right on it because they're getting to the heart of what really is at some of these problems.
There's a smarty pants on YouTube right now. Someone just said pituitary, like that's hormonal, diabetes insipidus, another hormonal issue, lack of vasopressin, hormones and from cholesterol linked back to malabsorption and get, oh my God, what a smarty pants. All right, so so this is great because I think Anson and some of you guys have a little hint around this, is that blood sugar, this is not does not belong with the cardiologist or the rheumatologist, because the underlying causes of POTS is number 1, blood sugar instability. Okay, boom. Number 2, hormonal instability, and number 3, guess what? Gut infections.
Boom.
And the thing is, when you have POTS, it's like college stopping, career stopping, life changing symptoms that you have. And Bethenny, I've seen her on videos, and she does a lot of little makeup tutorials and her favorite products and all that. I love those.
I love them too.
I addicted to those. So I've been watching it. I've been seeing her face change. Visually, I see it. Even I have who've been watching her on social media. And I've done this where I'm on a call with 30 people, 40 people, and I can already see, hey, everybody, lift up your neck. And I'm looking at their thyroid. I'm like, you got this problem, you got this problem, you got this problem, you got this problem. You
You can help visually.
have you ever seen me do the sleep apnea look thing? Because
No.
there's actually, FYI, one of the underlying causes for why men have low testosterone or adrenal fatigue is because they have sleep apnea. Men, women too. But there's actually like the distance between the chin and the neck right here. You can actually see who's at risk for sleep
Goodness.
apnea. So I don't know if that was part of when you went through the program. I had everybody turn to the side, and I was like, you got a problem, you got a problem, you got a problem, you got a problem. You're fine, you're fine.
Go check it out. It's funny, but that's just a part of your training. You have so much experience in being able to spot these things,
Yeah.
sometimes even just visually, and you can do the same with thyroid.
Well, I think what's really cool is my first, I'm an MD, and I spent the first 10 years of my career, 13 years of my career as a family medicine trainee and a family medicine physician, right? So I think that really helps out because then I have all the medical background. I'm dealing as a family practitioner with people with, prescribing birth control pills, low thyroid all the time, blood pressure problems, high cholesterol, so in dealing with them, I also understood the limitations. Like I only had a pill to prescribe if you have high blood pressure. If you have low blood pressure, I don't know what the hell to do with you but send you to the cardiologist. And yet this is one of the problems, right? And yet you send someone with low blood pressure to a cardiologist, what are they going to do with you?
Yeah. It's not much help because they'll look at your heart and they'll say, "Oh, your heart looks normal," right?
Mhm.
And then
And just like someone else just said, oh, my thyroid tests keep coming back normal. And I'm sure they're going to tell you some bullshit about how your hormones are normal too, or why you don't need your hormones tested. Here's the problem. They don't know how to read your thyroid test. They don't understand hormone patterns, and they don't really give a rat's ass or have any training about blood sugar. And it's not because they don't care. It's not because I didn't care as a physician. I didn't know. I didn't know. And I was a damn good family physician, but I am a better healer today because I have experienced this myself.
Mhm.
I've seen hundreds and thousands of people go through the program And I have been able to see these recoveries, and I can see the steps. The success leaves clues. So I'm like, this is why these people were successful. These were the linchpin. I mean, how many interviews have we done with people with POTS or dysautonomia? Probably at this point, 30, 40. And
At least that's just within the last year or so. It feels
right.
like.
And then when you ask them what their linchpin is, they tell you. So
Mhm.
my clients who have turned this around are telling me, "Oh my God, it's the blood sugar. It's the blood sugar. Oh my God, it was my PCOS. It's my hormones. Oh my gosh, it's my adrenal fatigue." Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. What that's going to do is it's going to bring you to a calendar, pick a time that's going to suit your needs best. It's going to be about a 15-minute phone call. After you book that call, there's going to be a link to a short questionnaire. And that's really important for you to fill out because it's for us to get to know you better and helps us to better prepare to make the most of our time together. After you fill out the short application, it's going to take you to a page where there's a couple resources. What I want you to do is go ahead and click 2 of those and watch those. 2 trainings. They're going to really best prepare you for your phone call with us to make the best use of our time together. I and my team look forward to talking to you to learn more about you to see if we are indeed a good fit to work together. Thank you.